All right. Hi y'all. What kinds of organizations have you heard from? Like, have you heard from nonprofits in this class before? Ish, maybe? Yeah,
No.
some, okay. Well, I want to talk to y'all. I want to make sure that everyone online can also hear me, so I just need to stand right here.
They should hear you.
All right, I'll be loud anyway. Yeah. Um, about using technology for good. So when I was in college, I didn't think about nonprofits for a career opportunity because I wanted to be able to pay my bills, right? Just generally speaking, to be completely straightforward, nonprofit doesn't end up making you a ton of money. But being able to work to like serve your community and build technology or use technology in ways that are going to help other people is really fulfilling. So I'm going to talk about how we do that at SC Thrive. Generally, who is SC Thrive? We're a nonprofit that connects people with community resources when they're in need. Our mission is to lead South Carolinians to stability by providing innovative and efficient access to quality of life resources. We do that in several different ways. So we have training where we train people on what resources are available. So that's things like, what is SNAP? What's food stamps? What is Medicaid? What can Medicaid cover? But it's also things like mental health first aid. So when you're in the community or even talking to your next door neighbor or your sibling, and they're in the middle of a mental health crisis, what do you do? So that's like CPR, but for the mind. So how do you help somebody in a crisis? We have tools, so things like how to help connect people to resource guides, stuff like that. But then we also have technology. The idea behind that technology is, what if we could make it easier for people to navigate complex systems of available benefits in South Carolina? How many of y'all have ever like known someone that ended up in a crisis, didn't know how they were going to get the next meal on their table for their family? Maybe they didn't know how they were going to pay for healthcare. Maybe they got a prescription, but they weren't able to afford it, didn't know what to do. A lot of times when we think about somebody being in crisis, the burden of navigating to find resources ends up on the person in crisis. When y'all are like in a panic situation, how many of y'all want to sit there and figure out how to access something and then have to jump through a ton of different loops and hoops on how to navigate all of these different things? So if you're in a crisis situation and say you lose your job, you've got 2 kids at home and they still need to eat, you have to go to the food pantry, and then somewhere else you have to go to DSS to apply for SNAP. And then it turns out that your car broke down last week. You don't have the money to pay for it, so you've got to use the bus, but you can only go to the office from 8:30 to 5, and you don't have enough PTO to cover the time that you would miss from work and then not have more money. Like, these things compound and all the systems in place don't necessarily work together. So that's the idea behind Thrive Hub, because when we look at the systems of support that we've set up, this is what it looks like. Anybody want to try and take this maze? Because I don't. It's hectic. And I can see that not only here in South Carolina, but also state to state. So I'm originally from Oklahoma. And if y'all didn't know, the different systems of benefits differ state to state. So getting help in one state is not the same as getting help in another state. I'm experiencing this right now with my grandma, trying to help her access Medicaid benefits for nursing home services. Nursing homes are expensive, y'all. They're really expensive. And so at the end of somebody's life and they don't have the money to cover it, for them trying to find something on a website is next to impossible. And so navigating these complex webs of support is hard. The idea behind Thrive Hub is, if everyone's on the same technology working together, it could be a lot easier. So when an individual in crisis reaches out for help at their local free clinic, that free clinic can then connect them with all of the other organizations in their community to help that client with whatever they need. So they're not having to navigate all those different things. So the idea is that ThriveHub is a system that can do that. We think that technology can be used to break down barriers to get people the health that they need. Our vision is stabilized, healthy communities. But a lot more goes into health than just, are they taking the right medicine, right? So it's things like, do they have enough food to eat? How is their mental health doing? Do they have the transportation they need to get to the doctor? Things like that. We know that addressing health holistically, so that means all of the different kinds of factors that can address health, takes a whole lot of different kinds of community members working together. So a way that we do this is we partner with organizations that provide direct services to community members, and we train them on how to use ThriveHub and then let them use it. So ThriveHub users could be hospital systems, they could be libraries, they could be food pantries or community agencies. So that when that individual who's in crisis reaches out, no matter where they reach out, they can get all of the kinds of help they need. So ThriveHub is that one-stop shop so that when someone comes into, let's say, a library, and they're talking to the librarian, they need help with their resume, but they don't know where to go, that librarian can help them apply for SNAP, can send referrals over to like a work support agency. They can send them a referral to the free clinic, but they can also track that client's progress over time. So if they're helping them access these resources, they can see like how they're doing over a period of time. So, and all of that is the technology that we've helped build over the last 15 years that didn't used to exist. And we can see that ThriveHub and different collaborative case management systems do work. We see it in this specific study with justice-involved women, and the difference that having that collaborative model, so multiple organizations working together to help care for that individual, can make for these women not having to go back into prison because they were supported and they didn't feel the need to do another crime. So through our work, we also see how social care and healthcare connections can make a really big difference. And so for those of y'all that are interested in like healthcare technology, there are some really cool and interesting ways that social care, which like nonprofit community-based organizations are trying to work with healthcare entities, and these two really large systems of care are trying to start work together. And it makes a huge difference for both families and communities. So the question, I didn't even realize or remember that I had a cat on here, but how does ThriveHub fit in? Which is a good question. Our current focuses are working on things and learning and communicating more about things like interoperability. So how do different systems build to work together initially? So making sure that the way that we build ThriveHub has those easy points of connection. It's using some of the same languages and things for connecting to healthcare. Also, a lot of APIs. So I could not tell you how often I get asked on a daily basis whether or not we can API with somebody else's system. Because a huge focus right now is to ensure that people aren't doing dual entry into multiple different systems, because in the nonprofit industry, sometimes we're required by funders to enter stuff into one system, but it turns out we really only use this other system. And also, it might be that there's 3 or 4 different systems for our 3 or 4 different funders. And so the ability to connect our software with other software so that those community agencies have more time to serve people instead of typing away is really important to us. We also have a huge focus on data. So are we collecting information in the right way? Do people have the ability to pull all of the information? And those are questions that nonprofits don't always have the answers to. So they may or may not be able to pull reports from the systems they use, which sounds wild to me. But it's the reality of the nonprofit ecosystem. So they don't have the funding to pay for the systems. I know organizations to this day that use paper and pencil to mark when their clients come in. And if you think that like being able to pull a report on that stuff should be easy, and it should, but if everything's on paper and pencil, it makes it really hard. So huge focus on data. There's also some really cool stuff happening at the national level when it comes to social care and technology. So there's a really interesting project that if you're interested at all, I highly recommend you looking into. It's called the Gravity Project, and they're setting data standards at the national level so that organizations like mine can take some of those standards and implement them into our software so that we could connect in the future. So that's I'm really excited about this. I could jump up and down with excitement about it. We've been involved with the Gravity Project since, I don't know, 2021. We're a tier 3 pilot system, and we've built all of the things in like the LOINC codes, the SNOMED CT codes, so that we can connect with healthcare organizations. So on this other side of it, that the healthcare side is being required at a federal level to build in some of the interoperability standards. So they're being required to be able to connect system to system. So we want to be sure that on our side, we're building stuff in to be able to connect with healthcare systems so that our two very large different groups can talk together. A big question that y'all might have is what kind of tech positions does an organization like SC Thrive have? So we obviously have positions that are Thrive Hub related. I will say we don't do any of the development. I don't have any developers on my team. It's mostly like project managers, people who train Thrive Hub or do a lot of testing. But we do work with technology companies who would hire the development positions. We have IT, so I work with my IT team, and that's everything hardware related mostly. So everything from servers to, hey, my printer's broken. So, and then data. We have a lot of data. We collect a lot of information. And so being able to use that, but also to connect it to tell a story. And so if any of y'all are interested in data positions, that is something that like you will have to navigate, is not only like what data do we have, but also what does it say, like how to really think through how that data can tell a story for an organization.
So are you using like SQL and Access, or are you using Tableau or Power BI? What is it?
We use a ton of Power BI, mostly because we can't afford Tableau. But we do use SQL in the sense that our vendor does use SQL, and we use a lot of his mapping for Power BI. So, yeah. I can't say enough about how lucky we are to be sponsored and funded by a ton of different organizations throughout the state, and I appreciate them. And yeah, I appreciate your time, but what questions do y'all have? So we do have on my team someone on staff that works directly with data and analytics on a minute-by-minute basis, but we've also had internships for data and analytics. And so I do know that all of those were through a class here. So if y'all are interested in doing data and analytics internships like that, we're more than happy to take a look at that and have a lot of room to explore what that might look like. Just depending on like what kind of internship you're looking for.
They're all looking for it.
Yeah,
So this summer they have to have.
okay. Well, I have room for interns if you need an internship for sure. For sure. What else? What other questions do y'all have? Yeah,
So for your intern, what would you expect the to be doing? Is this a internship where we should be capable of getting people into the work and helping with the them out?
ideally, yes. So we want somebody to be able to dig in and really help us build dashboards. So I will say one new thing that we've implemented in the last, I don't know, 12 months is Power BI. It is brand new to us because we don't have we didn't have a data warehouse. Like we didn't have somewhere where all of that was stored. We transitioned softwares in 2019. And so have just recently gotten to the point that like we were able to connect all of that together. Because of that, like we have a lot of need for dashboards that don't yet exist. So like some of it could be dashboard building, some of it could be more along the lines of like figuring out how we have things set up, whether or not that could help. But open to really whatever like y'all are interested in, because I want to be sure like if we do an internship, it really focuses on y'all's strengths. Because we've had some internships where we had an idea of what we wanted going in, but that might not have been like the best fit for the person. So in the long run, also want to make sure it works for y'all.
So you're saying that we can do data, we can do IT, like tickets, we can do
Software.
software on the hub
Mhm.
and project management?
Yep.
So is there like 4 openings that you could fill
Yeah,
or more?
or more.
And are
And-
they paid or not?
So I don't have any funding right now to do any paid internships, unfortunately. Like our, as y'all may be aware, some of the federal changes really impact grant funding. And so that being said, we don't have any extra to work with. Yeah.
What part?
In the past, we've had them be part-time, so really flexible, like with your schedule, especially y'all are in school, like you need to be able to get to class or to do jobs that could pay you, and that's understood. For
So,
sure.
and just so you're aware.
Mhm.
The summer program that I've asked
Mhm.
to participate in, the 400 hours,
Yeah, okay,
which I want them to understand what it feels like to work full time in IT.
okay,
But at the same time, if they're volunteering or they're just wanting experience, wanting to build their resume, this would also be good, what I call part-time interest.
Mhm.
But if you guys are also like on a time crunch, I don't mind if you find 2 part-time ones, like if you're saying, hey, I found one with my church who's paying me a little bit, I need another part-time one to maybe work with a nonprofit. I want to get my hours so I can graduate regardless. I'll count that, okay? So if you're trying to figure out, I need some additional hours or whatever, then let's talk and we'll figure it out, okay? Don't postpone your graduation, I mean, there's plenty of options.
yeah.
Okay.
And if, you know, if for whatever reason, like we get to our max capacity, we work with hundreds of partners throughout the state that may also need help. So if you're interested in doing an internship for a nonprofit, I can find you one. So. Yeah. My tech stack. What a good question. A mess. It looks, so like we have a call center where people call in to do applications over the phone as well. And between our call center technology, with Thrive Hub, our actual CRM that we use, and a number of different products, I believe the least amount of softwares that any of our employees access on a daily basis is like 8. So. How fun.
Yeah, just as an FYI, if you remember all semester, I've been giving you grant opportunities, so the Richter Scholarship, 2 of them. For those who are working for nonprofits, you can apply for up to $5,000 for those. There's the one from a legislator, I heard it was $2,000 to $3,000. So there are things that you can start applying for and still work for them and get paid, even though it's not directly from the fund. Okay.
So you know, like, yeah, for it to be like a full-time position, like you just don't have to work. Or,
It's not that we don't have the work, it comes down to funding. And so like with a normal company, like a for-profit company, like we could find the money in the budget to add a position. With ours, our funding specifies what positions we can employ. And so like we would have to get like a new source of funding for a new position.
So like when you have nonprofits and government, there are grant supported positions. And that grant can be 1 year to 3 years to 5 years. And once that grant's up,
Yeah,
you may be up. So what happens is, a lot of people do that. I mean, they just jump from grant to grant to grant. One thing to be aware of, when you do that, you do not, even though you're working for the state or for a nonprofit, you do not get state credit, I guess you would say, or the benefits of being a state employee. Okay, you're just representing the state to a grant.
yeah. And I will say the majority of nonprofits do what's called a fund braiding, where we have like a number of different grants and contracts, maybe even some program income or donations that are all braided together to help ensure that we don't have to let people go when a grant ends. But it's a hoop. So,
so even though the position is unpaid, the unpaid and uncapable, putting in a full-time hours.
we could, well, I just haven't had any full-time
Oh.
interns in a while. Yeah. Yeah, so if you are looking for that full-time over the summer, we can make it work. My interns lately have been during the semester, not necessarily outside of a schedule, so. Awesome.
So, in touch with you about the.
Yeah, absolutely. Email me. I'm also, next week is spring break, for my kids, and so I'll be away from phones and stuff. But if you email me, I'll get back to you as soon as I can. Yeah,
Just, first, like, email your resume, like,
that'd be perfect. Yeah. Yeah, and just make sure in the email you let me know that you're interested in an internship, because I might forget. So, yeah. So there is an open application that you're more than welcome to submit on there as well. That one's specific to a data internship. But if you're interested in another kind of internship, please email me. Yeah, and if you do submit online, please also email me so that I am reminded to check it, because I have to go through all of those resumes and I get a lot from outside of South Carolina. Yeah. Just email me. Yeah. Yeah, good question. What else, y'all? Any general questions? So like helping people use Thrive Hub? That's a really good question. So technically, that's not IT staff from our end. That's what we call our outreach staff. So we have staff members that live throughout the state, like in the communities that they serve, that travel like from organization to organization, supporting them in some ways. And so like they'll do the initial training, they'll do work with them to do implementation. So helping set up the software, like the settings and stuff exactly how they need it, help developing their workflows. And then like that day by day help, like, hey, this thing did something weird, what am I supposed to do? Or, hey, I forgot how to do this, or this person left and we need a new person trained, that kind of thing. Sure. Awesome. What else? Yeah, say a structure. What do you mean?
So we're CPO.
Mhm. Yeah. Okay, so like our like hierarchy or whatever, okay. So we have like a level of like C-suite essentially, so like all of our chief financial officer, chief grants officer. And under them, like really fall some of their programs. So we have a chief training and development officer that has all of our training team, chief community relations officer. I think I'm getting titles mixed up. But under my team, I've got IT, data and reporting, and then Thrive Hub. Our IT, like we have someone in office, but technically they're an employee of another company. And so it's just the one person like with a company supporting him. Data and reporting, we have the one person, but then like interns in and out. For Thrive Hub, we have like our one major project manager. And then she has a specific team on her. They're like the SCDC team. So they work in correctional facilities they use Thrive Hub in the correctional facilities to help the incarcerated individuals. Yeah.
And also, is this nonprofit that has been? So you said that seven funding. So.
Yeah.
Is it like varying, like some administrations around this and then some administrations?
Yeah, so just depending on like the administration and how it functions. When we look at like Republican administrations, they usually have more contracts, less grants. We look at Democratic administrations, it's more grants, less contracts. And so it's not like we haven't had any funding like officially stopped. We've had grants that won't get announced. So like we would have received the grant, but now the grant's on pause. It's more stuff like that. So like there are definitely a lot of nonprofits that have lost funding. We haven't, and it's not necessarily us yet, but we never know. Yeah, it's just like where the money flows changes. And that's really like why you see a lot of nonprofits with braided models where like they don't rely entirely on grants or entirely on contracts because it's cyclical. Like it's gonna change and it will continue to. So.